Greetings. Welcome to my YouTube channel. My name is Mushtaq Memon, Professor Emeritus from Washington State University. This our second video on bull infertility is focused more on preputial injuries. So before we start talking about the preputial injuries, let us again very quickly go through this picture of reproductive tract of the normal bull. On your left-hand side, as you can see, there are two pendulous testes where the sperm are produced and then transported to the epididymis, and then they are stored in the tail of the epididymis. So when animal is ready to ejaculate, the sperm come from the tail of the epididymis through vas deferens and mixed with the seminal plasma secreted primarily in seminal vesicles, and then semen comes out from the bull through penis. And then on the right-hand side picture, you see showing the part of the glass penis at the bottom, and it has that fold of the tissue on top of it, and that's a prepuce. And then prepuce all the way, connects with the skin of the bull. So that skin line where prepuce comes in contact with the, the rest of the prepuce, that is fairly important for us. We want to make sure if injuries happen, does it involve the hairline or not? So that hairline injury becomes, a little bit difficult to treat and sometimes has a very poor prognosis. So let me tell you what we are talking about, these preputial injuries. So on the left-hand side on the top, you see a picture of a bull belong to the breed called Hereford. In the same way, we have another black color breed called Angus. So Angus and Hereford are very well-known beef breeds in the United States and also in many other countries too. So here, for purpose of this presentation here today, you could see the bottom of that picture of the bull is showing the prepuce, which is in black color, and there's a white slender part in it, which is the penis. So just to emphasize and showing that how penis is protected by the prepuce. And the prepuce in these breeds of Angus and Hereford are more kind of close to the body wall, what we call tucked up. Whereas if you compare, coming on the right-hand side of the bottom picture, is the Brahman or Zebu cattle. And they are the cattle with hump and had a very pendulous prepuce, as you can see here. On the top of that bull's picture is a prepuce, which is hanging down straight, down towards the floor. So what happens is that these animals, whether they are purebred Zebu or Brahman, or they're crosses, have this pendulous prepuce, so whenever they are in the rough brush or having some areas which are sharp, and they get injured from those things, and then things get complicated from there on. So here's the animal presented to us at Oklahoma State University, a bull. Happened to be, I remember that very well, is called what you call beef master bull, which has got the cross of the Zebu. So the prepuce on the top you see is hanging, but if you look at the other side of the prepuce, which is injured, is the bottom picture. As you can see in my hand, I'm showing this tear of the prepuce there, and then you could even appreciate from the picture the edema or the inflammation of this area. And this is what I'm talking about, that if this, the wound or the injury crosses or involves the hairline, then prognosis becomes very poor. So here's the picture of Angus bull. It's not really the old picture, it's more like a prepuce, but because of the black color, I just wanted to point out. So this is again another bull I remember fairly well. As you can see here, his injury and the edema has brought this prepuce all the way, almost dragging on the ground, so to speak. So in a way, with the treatment protocol is that we try to do the medical treatment on this prepuce means we will try to clean it and then try to reduce this edema by soaking the prepuce and then supporting it. So after we go through all these medical treatments, in some cases, still we have this extra prepuce there, which we have to reduce the size of the prepuce by doing one of the two surgeries. One is circumcision, other is the reefing operation, which I will discuss in my next video here. But for this purpose, let's talk about what we are talking about medical treatment. Well, we try to be as economical as possible. So we have more kind of homemade stuff here. We have on the top, as you can see, there is a jug of betadine scrub, not the solution. So the betadine scrub has a soap in it, and next to that is look at the box of the Epsom salt. So the bottom picture, what I'm showing is that you have this, we pick up this empty jug of betadine solution or anything, there are a lot of materials come in gallon jugs. We empty it out, we cut it on the top to make enough holes so that we can stick the prepuce inside, and then mix with water, Epsom salt and betadine scrub, and then, make 2 holes in the side, put our cotton gauze, and then put prepuce in it and hang it up there. I have to tell you that people, bulls don't like it to start with, but after a while, when you get nice warm water, they get used to it. But, we keep this bull in the chute so that they don't move around and start kicking that thing. So here is the other part of our, post-soaking medical treatment part of it. On the top picture, you see there is an ointment in the jar, and we have gauze and, the bandage material. At the bottom, you see a picture of what we call pessary tube. What essentially it is a piece of plastic tubing, the same tubing which we use for the stomach tube for bovine and some other purposes. So we take that gauze, make a kind of bulb on the one area, and I'll show you in a minute here. So we stick this pessary tube in the prepuce after cleaning and everything, and then bandage it to reduce the edema and then support that pendulous prepuce in that way. So this is what I'm talking about here. So as you can see on your left-hand side at the bottom, it's now, you can see quite a bit difference, isn't it? That prepuce, sole, and prepuce looks much cleaner. This is after the soaking. In here, you can even appreciate on left-hand side is a little flap of the prepuce, which is, injured and comes out from there. Now we have to support this one. So up on the right-hand side, you see the left picture is where I'm trying to apply this ointment on this clean, injured prepuce. And on the right-hand side, which you cannot see very well, so what we have done is we stick that pessary tube inside the prepuce, bulb goes at the end, and then try to bandage it to protect it. So this is where we end up. So you can see on the left-hand side, this is all bandaged, and protected prepuce. And you could see at the bottom a little piece of that plastic tubing hanging out, and the bulb which we made on this pessary tube, which is inside the prepuce. And then we bandage it. We make sure that your bandage material doesn't go on top of the tubing, because this animal has to urinate, right? And the urine has to come out to this tubing. So we want to make sure it's all protected. At the same time, we have a flow of urine without any problem. Now, once you have done all that, if we leave this prepuce in this way, which is bandaged, obviously, water is going to come down, the fluids, and then the edema will stay on. So now we have to support it. So here we are on the right-hand side. This is, again, homemade sling. These are 2, empty burlaps that we tried to, make a little sling out of that. And we made some holes that you can see there, and take some old tubing, bicycle tubing or some other kind, rubber tubing. So then we tie this prepuce up to the body wall of this bull and tie it up. So we keep on doing it every so often. We change this material maybe every 2 to 3 days, depends upon the intensity of the problem. And then bull is taken out from the chute and it stays in the store or limited area, even in the field if we have to. So it keeps on, changing these things and repeat this medical treatment. So here's the outcome of this medical treatment on this Brangus bull, which we started early. And if you can see all the on left-hand side, how this injured prepuce was presented to us on this bull. Then we cleaned it. On the second picture, you see, then put all this bandage material, repeated that a few times. And the right-hand side is a good news that this animal got, well, his prepuce got healed, and then it's ready to go home. So there have been quite a few different bulls which are, benefited from only medical treatment. And so this was a good outcome for us as well as for the client. These are the two references that I highly recommend, those of you who are interested in it. So the top reference is my paper, published back in the late 80s. Techniques haven't changed much. But at the bottom part is Dr. Hopper's recent outstanding chapter, which I would recommend for you to look into that. So our last and third video of this series is going to be the surgical treatment of circumcision and reefing in the bull. So until then, I wish you well. Stay healthy. Bye-bye.